Today we will be going over how to administer an IM injection. First, we want to start by performing hand hygiene. The supplies you are going to need to perform an IM injection include a medication label, 2 alcohol swabs, your medication, a fill needle. Some medications do come in an ampule and will require a blunt fill needle, injection needles. Most IM injection needles we will use in clinical practice are 1 to 1.5 inches long and are 22 to 25 gauge needles. You're also going to need a syringe and a pair of non-sterile gloves. To prepare your medication, you will first verify the physician's orders and the MAR, and review your medication information. Once that is complete, please perform your 7 writes and 3 checks in accordance with your agency policies. Then you are ready to drop your medication. To prepare your medication, you're first going to start by opening the syringe packaging using aseptic technique. Attach the end of the syringe to your fill needle. If your medication comes in a vial, swab the top of the vial with an alcohol swab and allow to dry completely. If the medication comes in an ampule, use an ampule breaker or an alcohol swab to break the top and discard of any broken glass. In our demonstration, we are using a medication in a vial, so we will inject the same amount of air as we want to drop of medication. Now, draw up required medication. Recap the needle using a one-handed technique and attach the filled syringe to your injection needle. Dispose of the fill needle in the sharps container. Prepare your medication label with the medication, the dosage, the patient's name, the time of administration, as well as the date. Before entering your client's room, perform hand hygiene and ensure you draw the curtain for patient privacy. First, we'll be going over how to landmark the ventrogluteal site. Place the palm of your hand on your client's thigh and with some pressure slowly slide up until you feel their greater trochanter. This will be a bony prominence in the upper portion of the leg. With the palm of your hand on your client's greater trochanter, ensure that your thumb is facing their groin. If your thumb is not facing their groin, switch hands. With your index finger, ensure that it is facing your client's anterior superior iliac spine. With your middle finger, make it face their iliac crest. This should form a V. Our injection site is between these 2 fingers. To landmark the deltoid site, we want to first find the acromion process. This is going to be the boniest prominence on our shoulder. Once you have located that, take 3 of your fingers from the acromion process towards your elbow. Then take your other hand and create a V. This triangle is the site of injection. Our third and final injection site is the vastus lateralis. In order to landmark for this injection, we need to locate the greater trochanter and the knee. Once identified, we want to break the upper leg into 3 equal portions. The centerpiece is our site of injection. Now that you can correctly identify an IM injection site, we are ready to administer the medication. Check your patient's wristband and identify your client using 2 identifiers. Using an alcohol swab, cleanse the skin and let dry completely. Pull your patient's skin taut, and then, with a darting motion, jab the needle into their muscle. With your opposite hand, stabilize the needle and inject the medication. Once all the medication has been administered, remove the needle and quickly activate the safety. You can then place a gauze or a Band-Aid over the injection site. Dispose of the syringe in the sharps bin. Document the med administration on the client's MAR. Now that we have explained and showed how to complete an IM injection, we will show a return demonstration completed by a Langare nursing student.
Hi there, good morning.
Morning.
So today I'll be giving you your IM injection today.
Okay.
And I'll be giving you over your deltoid side there, okay?
Okay,
So just before I start, I just want to check for armband here, and I'll compare it with the mark. Okay, can you tell me your first name?
Julie May,
Okay. And your date of birth?
January 23rd, 2000.
Okay. So like I said, I'll be giving it over your deltoid side here. So before I do that, I'm just gonna perform some hand hygiene,
Okay.
and I'll don some gloves as well. Okay, so before I go ahead, I'm just going to landmark the site, okay?
Okay.
So let's do here over the chromium process, 3 fingers below. And I'll take my other hand here, I'll form a triangle. And it should be right there. Okay. Right there.
Okay, perfect landmarking.
Thank you. So let's get my injection here and my alcohol swab. So I'm going to swab the site. And get my injection here. Oh, you ready?
Yes.
So I'm just going to spread the skin a little bit. Here we go. There we go. And I'll just put a swab there.
Good job. Well done.
There you go.